We'll quickly run through another type of peritonitis, which is known as what the primary peritonitis. All right, so for the primary peritonitis, we just describe it briefly and just kind of like describe it, state everything, and just briefly talk about the treatment. All right, because we have already spoken about the general peritonitis, we've spoken about the treatment, so the treatment don't really vary like that. Okay, just trying to make you guys know what primary peritonitis is. And when they say something is primary, that means what? The thing is originating from that site. It is if there is an inflammation and it's primary, that means the inflammation actually started at that tissue. It did not start from another place and spread there. Do you understand? That's what they mean by primary. And peritonitis, everybody knows, is just the inflammation of the peritoneum. That's a tissue that is what lining the gastrointestinal tract. Okay. So quickly talk about the primary peritonitis, which is basically what the infection arises primarily in the peritoneum. The peritoneum is not inflamed as a result of what infection spreading from other place to there. All right. In this primary peritonitis, the inflammation is as a result of what? It is starting from there. Okay. But it is quite uncommon. All right. And it's usually in young girls that are between what 3 to 10 years. And occasionally it happens in boys. All right. So if it is starting right there at the peritoneum, it is mostly caused by what? Streptococcus pneumoniae and the Streptococcus what? Pyogenes. These are the two organisms that are actually what? Overseeing the activities of primary peritonitis. Right. So in primary peritonitis, just like we know, there will be lower abdominal pain, there will be fever, there will be toxemia, there will be tender abdomen, and there will be muscle guarding in the lower part. If you want to touch it, the muscles there will be so tense. Okay. Then toxemia, that's presence of toxins. All right, bacterial toxins in blood, fever. You guys already know fever. Abdominal pain, you guys already know. Of course, it is happening beneath. Okay, the skin of the abdomen, so it will show off as what pain on the outside. All right. So diagnosis is what intraoperatively when no primary disease of viscous is found. So you can actually open the person off on exploratory laparotomy and try to explore to see if what there is another disease somewhere causing it. All right. So if you don't see another disease causing it, you say that this is a primary peritonitis. Okay. Treatment is what you resuscitate the patient. Okay, rehydrate them, everything, make sure airways and all the stuff, right? By using IV fluid, using the nasogastric tube, using antibiotics, using then this exploratory or laparotomy is like the surgical treatment for this primary peritonitis. Okay, so another type of primary peritonitis is the one that is found in patients with cirrhosis of the liver, with ascites, or you can also see them in patients with what nephrotic syndrome caused by infections by the enteral bacteria, especially what the Escherichia coli and the Streptococcus what fecalis. Treatment is still the same way. Use antibiotics, intravenous fluids, and the nasogastric tube. Okay, so that's it about primary peritonitis. I will just move to talk about the secondary peritonitis briefly from here.